Hey everyone, welcome to Food Talk Live with me, Dani Nierenberg. A reminder that this episode will also air on our podcast, Food Talk with Dani Nierenberg, and you can subscribe wherever you listen to podcasts. Before we begin the show today, I want to give a shout out to a member of the Food Tank family, Victoria Pollock. She is the wife of my co-founder, Bernard Pollock, and she is in a doctoral nursing program at Columbia University, and she started with hundreds of her colleagues today working to treat people who are afflicted with COVID-19. So my heart goes out to her. She's a very special person, and I want to give her a shout out, and all of the people who are really working on the front lines of this, from grocery store workers and truck drivers to nurses and doctors, and all of the people who are making sure literally that we all stay alive and stay healthy and fed during this time. So thank you, Victoria, and thank you to all of those who are doing their best to keep us all safe. Today I get to talk to someone who's really interesting because his background is also in medicine, and that is Garry Michael, the co-founder and CEO of Farm2Me. He is a former professor of medicine and immunological sciences, a word that's hard for me to pronounce apparently, and has a background in lots of different medical settings as director at the Bellevue Hospital Pediatric Emergency Medicine for both New York University Hospital and Bellevue Hospital in disaster preparedness and response. He also co-founded, as I mentioned, this really cool way to create transparency in the food system, and that's called Farm2Me. And he's created, with his co-founder, a local food distribution model that's very, very interesting. So Garry, before we start, I just want to make sure that everyone in your family and your colleagues are all safe and healthy at this time. I know it's a really stressful time for everyone right now.
Yeah, no, absolutely. Thank you so much, Dani, for having me. Thanks for the introduction. As everyone in this country, I know people who have been affected by this virus. It makes obviously this mission and our work, I'm sure you've been affected, that much more difficult. But this is the time where when local food and medical personnel across the entire country have to step up and do their job and do what basically their mission is to do. We're staying busy.
I'm sure you are. I'm sure
Yeah.
you are. You have such an interesting perspective on this as somebody who's both a really staunch local food advocate as well as a medical professional. Tell me how, I think the Farm2Me model is very interesting, and I want you to give maybe a short description, and then we can get into how, you went from medical stuff to food stuff.
Sure. So, Farm2Me is a platform that basically acts as a database for local and organic food producers, farmers, food makers, distributors, wholesale clients, and press. I think at this point, most people that are watching this and know a little bit more about the local food space than people knew back when we started in 2010. But the idea at that time, when there wasn't much of a network, the only presence was an organization like Local Harvest. We wanted to connect the country and create a database that was very transparent, that was very connected, that was accessible and convenient, not just for consumers, but also eventually what we saw for wholesale clients who could buy this stuff and support the industry, for government organizations. I'm sure that that's a lot of the stuff that you do, advocating for this stuff to the government and policymakers, all that stuff has kind of come true over the past 10 years. And then specifically how I got into this for medicine is that, my background has always been in medicine. I've worked in hospitals since I was 14 years old.
Wow.
I went to university to study and graduate school to study medicine to eventually go on to medical school. And I, like most people who come into this organic industry, got sick. And by getting sick, I really started reevaluating where I wanted to be, how I wanted to play a part in the healthcare system. I wanted to get more involved in preventative medicine. I feel like this was going to be a great opportunity. I saw the niche that there was this missing piece, this idea of, consolidating the industry and educating the consumers. And we just, it happened at a time when Nobody was really, there were definitely organizations talking about it, but nobody was really consolidating on a national, international scale. And that's kind of where I came into creating Farm2Me with some amazing co-founders. Again, and what was really cool is in 2012, during Hurricane Sandy, I got to kind of combine my background in medicine, specifically in disaster preparedness and response for the federal government, and my local and organic food network, and bring these directors from hospital networks together with our team to build a disaster relief model using food as a way to prevent people from getting sick at a time when hospitals were down, groceries were down,
Absolutely.
Restaurants are down. Very similar to what we're experiencing right now. So
right.
Yeah.
I mean, an e-commerce model like Farm2Me can literally be a lifesaver. So what are you doing? You know, how has your model sort of changed because of COVID-19?
Yeah, of course. So, what's cool is the model has changed, but it's also kind of changed relative to the model that it was 3 weeks ago. It's very actually similar to our model during Hurricane Sandy. First thing I did, was jump on a call with directors of disaster preparedness and response. That was 2.5 weeks ago. We identified what the problems are going to be: supply chain issues, distribution issues. Very similar to an article that you put up on LinkedIn yesterday, pertaining to how this is going to affect the agricultural worker, how this is going to affect the supply chain. Identifying that grocery stores, similar to what happened in Sandy, instead of going down, are now empty. Restaurants, similar to Sandy, instead of going down and flooding, shut down due to quarantine in many instances. And we'll talk a little bit about how some of these different channels have pivoted in order to be able to respond to COVID. The next thing we did is we contacted, different partners on the Farm2Me side, producers, farmers markets, wholesale clients, distributors. And we, right away, 2.5 weeks ago, started piloting different programs that we knew would work. We saw work during Hurricane Sandy. And so we made contacts to organizations like Baldor, farmers markets, like the Hastings Farmers Market, producers themselves.
Yeah, I'm really interested in like some of those lessons that came out of Sandy that are helping right now. What really, what was the biggest thing you learned from Sandy that's helping you address this crisis?
Absolutely. First thing, we need to set up community hubs. What didn't exist then exists now. We have farmers markets in every community in the country, tenfold the amount of farmers markets we had in 2012. So we contacted farmers markets to set up hubs. And those hubs are very similar to Sandy in the sense that the community can come and pick up produce from the farmers market. Now, the difference between this and Sandy is that we don't want an a la carte model. We don't want consumers touching produce, contaminating produce, contaminating the farmers that are at the farmers market and the staff that are volunteering. So we piloted a program where we want to pitch a CSA drive-up pickup model where a consumer can come, place the order through an e-commerce platform at the farmers market's Facebook page, coordinate for a certain time of pickup, drive up. The farmers market volunteers already have a prepackaged CSA box ready to go, or a produce box. If people aren't familiar with what a CSA box is, just the generic produce box where you don't really know what's coming, but enough produce for you to feed your family, and then drive away. And it's amazing. Again, an article I read, an interview we watched a week ago on this show. I actually interviewed somebody from the Mill Farmers Market in Minnesota on the exact same subject. So it's scaling. We saw distributors playing a part, wholesale distributors playing a part during Sandy. We, as a distribution organization, actually had to stir up volunteers to drive. U-Haul donated trucks at that time. The idea is a distribution model that's bring wholesale product to these hubs, and also directly to the consumers, because we have a lot of vulnerable populations that were living in buildings, a lot of people who can't leave their homes right now, who need produce and need food. And so the B2B model was we contact an organization like Baldor and suggested, hey, if you have trucks and you have software, why not convert that to a B2C model, right? And ultimately, really, can we convert a B2B to distribute to a farmer's market as the farmer's market's demand increases to be able to feed more people? Because right now we're only at about 3 or 4% of the population that is affected by COVID.
So a B2C model for our viewers is business to
Sorry.
consumer model. No, I just want to make sure that people understand. No, and it's so interesting. I mean, how worried are you? You know, you talked a little bit about the safety concerns for both eaters, you know, who go to farmers markets and, you know, people who are picking up food or whatever. How worried are you about farmers right now in a couple of different ways? One, their health. And two, are we going to lose the small farmers that have grown so substantially over the last, 20 years, who have filled these farmers markets and made them grow so much over the last, 2 decades?
Okay, so that's probably the most important question I had for the directors of disaster response. We wanted to understand from a medical perspective, somebody who's been doing research on this for 20 years, what are the ramifications of this? What happens when we don't run a quarantine program, a national program? What is the spread of this thing? How many people are going to be affected? And how can we kind of slow that growth, lower that curve or flatten that curve or whatever terminology that the federal government has decided to use? But yet the answer has always been limit your cross-contamination. If you can control CSA boxes literally from a farm, and a farm is packing boxes on the farm and doesn't have to leave the farm, and they're just minimize the amount of contact a farmer makes with the consumer, the better we're off for two reasons. One, we can basically identify the supply chain. We know that box is coming from that farm, and if that farm gets COVID, we can shut off the supply chain. But more importantly, when you're at a farmer's market and you're 6 feet away from a farmer or a farm worker, which is often the case, I'd say probably about 50 to 60, maybe 7% of the time, you're coming really close to your supply chain. And if those guys go down, that farm has to get shut down. And if they don't get shut down, the workers are going to protest for that farm to be shut down temporarily. And then we start talking about supply chain issues. That's probably the answer to your first question.
Yeah.
Yeah.
No.
Second half, go ahead. Second half of the question is, what happens to the producers? So the good thing is, and the reason we shouldn't actually worry about this whole movement, is that we saw during Hurricane Sandy is that farm team movement actually grew 300 to 400% larger after Sandy. And that's because the federal government doesn't have the infrastructure in place to move quickly. They have the infrastructure to respond over a period of time. But in the short term, when people are starving or malnutrition, especially during a breakout like this, where you have to be super healthy, the local food system actually can respond within hours or even 24 hours. And so the local food movement and the farmers are playing an enormous part. They're strained. We're seeing numbers like 400 to 700% week over week growth in sales for a lot of these guys right now. So short term, they're going to play a big part. Long term, I'm not an economist, my background is not in agriculture in that sense.
Sure.
My guess is going to be that the demand probably will decrease eventually. And then the question will be, how do we respond to this? And then historically, it's always been, if you go back to the Great Depression, it's monopolization, consolidation of the farmers. Yeah. And that's where kind of a farm network really comes into place. Can we create a cooperative or an e-commerce model where farmers kind of share a little bit of that profit or share networks, they support each other?
Well, that's my real fear, as I've been sort of, talking to experts like you and talking to so many people. After this is over, what happens? And I think we can't go back to like the business as usual model that we had. I think we have to, figure out a way to support local and regional food systems in a very different way so that, people aren't panic buying at grocery stores, that they're not, concerned where their next, box of produce is going to come from. And so I wonder how you feel about that. How do, platforms like yours, how do advocates, how do nonprofits sort of advocate for making sure that we don't go back to what we had, because it wasn't working that well?
Right. Well, the good thing is that we're not going to go back to the way things were, right? I mean, eventually human behavior changes over time. If we're all quarantined for months at a time, if you talk to any PTSD or psychologist, they're going to tell you human behavior changes. If we're used to staying at home, we're most likely going to continue enjoying the time with our families, even after this thing is all over, and spending more time at home. And for cooking, 4, 5, 6 days out of the week, and only maybe ordering out once a week, if that, that's probably going to the way the consumer, the American consumer is going to behave when this is all over. And so the entire model changes. Barbara Corcoran was actually on Instagram Live maybe 2 weeks ago talking about this. She's not concerned with her older business, and she's in a unique position because she has tons of investments, but she's not concerned with her older businesses. She's concerned in seeing how the economy and how the market is going to change, what opportunities there are a ton of opportunities for brands. Some of the things that local food advocates can do is things that we've done. I can't speak for things we haven't done, but I've spent 2.5 weeks thinking about this. Showcasing local food makers. We're running giveaways every single day on Farm2Me's Instagram. Every day, free giveaways.
Nice.
We don't care what your economic or your condition is, as long as you have access to internet. And that's a whole other issue. The question is,
I want to get into that.
Internet.
Yeah.
A lot of people rely on public internet sources like libraries and things like that. That's something that we're concerned with. But if you have a neighbor who does not have access to internet, please, promote local food makers and our giveaways. Give it to them. Promote producers. If you're a local food maker, you should be selling e-commerce online. If you're a restaurant, you should be going and setting up DoorDash and Uber Eats, getting yourself online. Restaurants are seeing 200% growth if you're staying on board and doing e-commerce. If you're a distributor and you're doing B2B, please don't shut down because your restaurants are closed. Look at other models. Look at a B2C model. If you could partner with an e-commerce platform, if you could build an e-commerce platform, ask your owners to invest, $40,000 that they have into building an e-commerce platform. Tons of software engineers that are unemployed right now that can help you.
Absolutely.
Shifting to a business to consumer model, meaning home delivery, B2C model, from a B2B model, which is business to business, on to grocers and wholesale and other looking at the CSA model, selling to farmers markets. If you have a lot of capacity, start building CSA boxes and helping farmers markets scale. They've got a 500% week over week increase in demand. They don't have enough vendors to the farmers market to be able to fulfill that. They're going to need to switch to a CSA model, and you guys have inventory. Those are some great ways to kind of jump into it right away. Create a food pantry if you have in your neighborhood, and partner with Feeding America and get them to donate product to you, and start canvassing up to buildings and finding, vulnerable and older people that need food. These are all ways to help.
Yeah, all interesting advice. You mentioned DoorDash and Grubhub and Uber Eats. How could they sort of tap into what you've done? Do you know what I mean? Like, instead of just, getting food from restaurants, how could they, sort of incorporate some of the lessons you've learned? Is there an opportunity for that?
Absolutely. So what's really weird, and it's hard to even imagine, is that in 2012, during Hurricane Sandy, we didn't have Uber Eats, DoorDash, or Grubhub delivery. It's very strange to think of it that way. There was no way to get somebody to pick up food from a restaurant and deliver it 5 miles away to a house. You had to be within like a half a mile radius of a delivery. So yes, they could definitely play a part. The only model that I've thought of, and I'm sure there are many other models, is partnering Uber Eats, DoorDash, and other organizations with pantries, soup kitchens, farmers markets, doing delivery from there. The government of New York City announced that Uber Eats, or maybe it was the state of New York, I'm not sure if it was Governor Cuomo's office, but they announced that Uber Eats and DoorDash and Grubhub are going to play a larger part in distributing food. I have not had enough time to really delve into it. Maybe you have, and you could probably talk to it a little bit.
I can't, unfortunately.
But yeah, I'm sure as you do, you read enough headlines and stuff. Just kind of spreading this knowledge that is a model right now that they're considering is something that people should look into. The hard thing about Uber Eats and DoorDash and Grubhub, for people who have never used it before, is that it basically, instead of grouping orders together, assigns you a individual driver to pick up food for you. Back in the day, if you order pizza from a pizzeria, they might have 4 or 5 orders. Grubhub and DoorDash basically have one order for you at a time. And that's the way the model works. It picks up directly from a wholesale to your home. Anyone, organizations should think about how they can incorporate these guys into their new model, because there's a lot of them, and they're onboarding, I think, like 40,000 new drivers. So it's a lot.
And hopefully find out ways to protect those workers and make sure they're paid well, because that's often been a problem with a lot of this. Transparency is such a huge part of what you do, and that word gets thrown around a lot. But I think transparency now in this crisis especially is more important than ever before. But you've had this real focus on what you call chemical-free food, and making sure that farmers and consumers, are either eating very healthy food or growing very healthy food. Why is that more important now?
Sure. So, first and foremost, what's really important is stocking up on fresh produce, stocking up on nutrient-dense food. Um, Obviously, if you can't get an organic or locally sourced apple, it is important for you to get, any kind of apple. But of course, during crisis and times when we don't leave our house, we're in confined spaces, we don't have access to doctor's offices like we normally do. We don't have access to hospitals like we normally do.
Yeah.
We're spending more time indoors. You're not getting your vitamin D. You're not getting your vitamin E. We can't go to the farm. We can't go to the grocery store because the grocery stores are empty. So we can't go to the grocery store as much as we can. We can't shop from restaurants like we normally could, or our favorite juice shops like we normally could as readily.
Mm-hmm.
It's really important to eat healthy and prepare your immune system for if you get for the day, if the day comes that you get sick, any kind of sickness, cold, flu, viruses, all those guys are still around. Those guys haven't disappeared. And of course, the coronavirus. Statistically speaking, speaking as a medical professional, in order to kind of remove any kind of virus from the system, from the country, you need to have at least 60% of the country, or you have at least 60% of the country vaccinated against that disease, no matter what that disease is, especially a fast-spreading disease. So unfortunately, probably most likely the majority of this country, over 50% of the country, will end up contracting coronavirus at some point. Most of those people are not going to get sick, but the point is that, we need to keep our immune systems up.
Right.
And, obviously eating healthy, seasonally picked, right food, naturally unprocessed food, tends to be the healthier route. Now, when you start talking about processed food, now you start talking about adding additives, things like that. They're going to, extend its shelf life. Of course, if that's all you can get, that's better than nothing. If all you can get is frozen veggies and fruits, that's better than nothing. But oftentimes you go into, and I went into a family, dollar to look for produce to see what, I could pick up, or any kind of meat I could pick up. And most of the shelves are full of fresh fruits and fresh vegetables, meat, things like that. But then, you look at the staples, rice, beans, Doritos, they're all gone. And I think people are really stocking up on the wrong things here. Those things aren't going away, guys. Those players, they have enough inventory to last in stocks for, years and years in silos. Produce is really the hard thing to get. And what's really important here is talking about, what kind of produce is really good for you. And that is seasonal produce. We need produce that is around now. The produce that's around now, guys, is the produce that's resistant to, the different types of bacteria that exist now. And bacteria and viruses exist at different seasons, just like, certain animals exist in certain climates, or certain animals exist in certain conditions like water or on earth. And so you really want to eat seasonally right now, because those nutrients are going to be incorporated into your cells and into your immune cells and keep you healthy. Again, fresh fruit, fresh produce, fresh, anything that's been harvested, as, obviously as local as possible. Also, something we're, for some people that they're going to debate that argument, shelf life. Shelf life is really important, especially now, because most people don't want to go out. They don't want to go to the grocery store on a daily basis, or every, weekly basis. They want to shop 2, 3, 4 weeks at a time.
Yeah.
When you buy produce from a distributor, or produce that has been shipped across the country or been shipped across the world, guess what? That produce is going to wilt, and it's going to wilt quite fast. I've consulted on many restaurant projects, and we always tell them that if you buy stuff from a distributor, it's going to be the exact same produce from the exact same farm. If you get it directly from the farm, that could sit on your shelf for 2 or 3 weeks. If you get it from a distributor, you're getting 4 or 5 days max on that product. So same product, seasonally picked locally, is going to give you a 4-week shelf life. Distributed from a grocery store, probably not that long. And then you're going to end up tossing it or getting creative with it. So supporting local and seasonal is really beneficial as well.
Yeah, you don't want all that fresh compost to end up in the trash or the compost. You want people to benefit from it. And you brought up some really good points that I think are sort of silver linings, if we can call them that, from this crisis. People are eating they're eating less processed food to some extent. I know you talked about people stocking up on Doritos, but people are cooking again. They're getting in their kitchens. People have been ordering seeds because they want to grow their own produce. I mean, I think there are some real people are thinking about eating seasonally, like you mentioned, and because, often, especially during this time of year, that produce lasts longer. We're talking about like tubers and potatoes and carrots and beets and things like that. So, it's kind of interesting. I think people are learning to appreciate food in different ways again, and appreciate where it comes from, and how, how we can't do without it. We literally need to eat several times a day. So, those are some of the silver linings. Before we started recording, you asked me what was the most interesting thing that, I've seen over the last few weeks since this really, since COVID-19 really hit the United States. Who's inspired you the most lately? Who are you most excited about? Any business, or is it your own, or, who's giving you some hope right now?
Yeah, absolutely. Well, I mean, some of the organizations were already mentioned, so I'll skip those guys. If you miss any part of this interview, you should probably go back and really slow it down and take down some notes. There's a ton of information here. Dani probably knows about most of it, but some of you guys may not know about some of the organizations, some of the models that have worked, and you can Google them right now. They'll be at the top of the Google results with articles about the models that they've run. Another organization that's really inspired me is an organization I reached out to 2.5 weeks ago because they have an e-commerce platform, and that is Milk Run. Milk Run is an organization that was started in Portland, Oregon about 3.5 years ago. Again, with that kind of premise, to support fresh and local food, all the things we kind of talk about, right? Keeping people at kind of the center of their model, the core of their model, making deliveries to people's homes, making deliveries to vulnerable populations. And when I speak to the owners at Milk Run, they're really in line with this idea of also supporting the disaster relief sites like farmers markets, like food pantries, and partnering with organizations like DoorDash and Uber Eats or other distributors to kind of handle that last mile, along with volunteers. So their model's really in line with what I'm working on, and they can tap into our network of producers and our distributors. So that's an organization I'm really excited to work with and bring to other states. Just as an announcement, we're moving to New York and to Michigan in the next couple of weeks with those guys. And there are going to be tons of organizations like that, e-commerce, that focus, again, on the stuff that we talked about, CSA boxes, to people's homes, to community organizations, and ultimately to vulnerable populations through disaster relief and donations. And of course, our own organization right now, during triage and during disaster relief, we take product from farms and connect them to disaster relief organizations. During Sandy, we worked with 35. We're kind of hoping to get to the point where we're working with 500 or 600 during this pandemic, just due to the fact that it's been 8 years and we have a much larger network and we're able to do that. So you can always go on to Farm2Me to find out more about that. You can donate to support that program, and otherwise get involved.
Yeah, absolutely.
Get involved
so again,
any which way you can.
Absolutely. Such good advice. And so your website, I love it. It's www.farm2.me. So you can Google it, Farm2Me, but it's very creative. Such a pleasure to talk with you. I'm so glad for all the things that you're doing and all the sort of inspiration you're putting out there. Just a reminder that this episode will also appear on our podcast, Food Talk with Dani Nierenberg. You can find out more information about Farm2Me on our website, foodtank.com. Another reminder is please join us back here at 5 p.m. when I'll be interviewing Jason Lusk, an agricultural economist from Purdue University. Thanks so much to you, Garry. Please stay safe.
Can I say one last thing?
Of course.
For all the young people that are in university and high school, in their 20s and 30s, who are thinking about what their new career choice is going to be or what they should do right now, get involved in local food. It is imperative for you to just jump the gun and get involved in any organization you can get involved in. If you think it is a dream and a pipe dream and it can never happen, 10 years ago, I was that person. I never thought I'd be sitting in front of Dani Nierenberg on Food Tank. And 10 years later, on a 10-year anniversary, I'm doing this interview. So please get involved in any which way you can. We need you.
Awesome. Great advice. Again,
Yeah.
sir, stay safe and stay well. Bye,
Thank you.
everyone.